Good morning. I understand that your primary care physician referred you to me after you were diagnosed with thalassemia. How are you feeling today?
早晨醫生，我冇乜事，我唔明白點解話我有呢個病，我完全一啲症狀都冇。
Thalassemia is a genetic blood disorder that affects the production of hemoglobin, which is essential for transporting oxygen in your red blood cells. It results in an imbalance in the alpha or beta chains of hemoglobin.
好複雜，意思話我嘅紅血球有問題，係唔係？
Yes, exactly. Because of the hemoglobin imbalance, your red blood cells may break down prematurely, which leads to anemia, or a shortage of red blood cells in your body.
我需唔需要輸血呢？
It depends on the severity of thalassemia. Some people with thalassemia may require regular blood transfusions, while others may have mild symptoms and only need treatment occasionally.
我嘅有幾嚴重呢？
We can perform a blood test to evaluate your hemoglobin levels, red blood cell count, and other parameters. We may also look at your mean corpuscular volume and mean corpuscular hemoglobin to assess the size and color of your red blood cells.
需唔需要做骨髓活檢？
A bone marrow biopsy is usually not required for diagnosing thalassemia unless there is an unclear diagnosis or if we suspect other conditions like myelodysplastic syndrome. We typically rely on blood tests for thalassemia diagnosis.
我記得我嘅家庭醫生話呢種病有唔同嘅種類，係唔係？佢話啲細節要問你，因為佢唔係專科醫生。
There are two main types, alpha thalassemia and beta thalassemia. The severity depends on how many of the hemoglobin genes are affected. Do you know which type your doctor diagnosed?
我唔知。
We'll need to check your hemoglobin electrophoresis results to determine the exact type. I'll also want to look at your family history because thalassemia is inherited.
我諗我冇屋企人係有呢種病。
Maybe your parents or your grandparents had it, but they didn't know because they didn't have any symptoms. Since thalassemia is inherited in an autosomal recessive manner, if both parents carry the mutated gene, there's a 25% chance their child will have thalassemia major. Are you married? Do you have kids?
我結咗婚，但而家冇小朋友，亦都未決定將來係唔係會有小朋友。
If you decide to have children in the future, it's important to know about your thalassemia. If your partner is also a carrier of the thalassemia gene, there's a possibility that your child could inherit the condition. If needed, we can arrange genetic counseling to help you both understand more.
而家暫時唔需要，如果將來我哋想要小朋友，再考慮去諮詢。如果將來我哋有小朋友，我伴侶應唔應該都檢查下有冇呢個病？
Yes, if you plan on having children, it's best for your spouse to also be tested to see if they carry the thalassemia gene. If both of you are carriers, there's a chance you could pass the condition on to your children.
呢個病會唔會影響我哋嘅性生活？
Thalassemia generally doesn't directly affect sexual life. The condition primarily affects hemoglobin and red blood cells, leading to anemia and fatigue, but it doesn't have a direct impact on sexual function. However, if the anemia is severe, it could lead to fatigue, which might affect energy levels, but with proper treatment, this shouldn't be an issue.
我差啲唔記得，我有一份有關我呢個病嘅文件，要俾你睇下。
Based on this paper, it's confirmed that you have beta thalassemia. In this case, a hemoglobin electrophoresis is not needed, as you already have a confirmed diagnosis.
係咩意思？
Beta thalassemia occurs when there's a mutation in the beta-globin gene. If both copies of the gene are affected, it's called beta thalassemia major, which is more severe. If only one copy is affected, it's beta thalassemia minor, which is milder. Yours is beta thalassemia minor.
係唔係因為我係輕型所以我冇症狀？
Beta thalassemia minor usually doesn't have obvious symptoms. Since you only have one mutated beta-globin gene, the condition is generally milder. Even if you have anemia, the symptoms are often very mild, and most of the time, you may not feel anything or just experience slight fatigue or paleness.
我而家係輕型，會唔會將來變成重型呢？
No, beta thalassemia minor won't turn into beta thalassemia major. But you could marry another carrier of the thalassemia gene and have a child with beta thalassemia major.
我而家知道咗自己有呢個病，我想知道呢個病點樣影響我嘅日常生活呢？
For individuals with beta thalassemia minor, daily life is usually not greatly affected. Most people can work and live normally. Of course, if you sometimes feel tired or have mild anemia, it may affect your energy levels, but as long as you maintain a healthy lifestyle, like eating a balanced diet, exercising moderately, and having regular checkups, you can generally lead a normal life.
有冇食物限制或者活動限制？
No, you can eat normally. As for activities, you can exercise normally, with no special restrictions. But if you feel tired or unwell, it's important to rest and not overexert yourself.
我需唔需要接受任何治療？
For thalassemia major, treatment often involves regular blood transfusions to replace the red blood cells and iron chelation therapy to prevent iron overload from transfusions. But you are beta thalassemia minor, so you do not need any treatment.
有冇啲咩我係需要知道？
Yes, I am glad you asked because I am about to tell you that. You'll need regular monitoring, including blood tests to check your hemoglobin levels, iron levels, and liver function. You can do all this with your PCP. We'll also monitor your bone health, as chronic anemia can lead to bone thinning.
我有遺傳性骨病，我有定期做骨密度測試，結果都好正常。
I am glad to hear that. Bone problems, like osteopenia or osteoporosis, are common in thalassemia because the body tries to produce more red blood cells in the bone marrow, which can weaken the bones over time.
其實係我嘅姐姐查出有遺傳性骨病，我自己係冇事嘅。醫生話除咗定期做骨密度測試，我係唔需要食保健品或者藥嘅。但係而家查出我有呢個病，我應唔應該開始食補骨嘅保健品？
For bone health, we might recommend over-the-counter calcium and vitamin D supplements. In the future, if you have significant bone thinning, we may consider other medications like bisphosphonates to help prevent fractures. But I strongly advise you to ask your orthopedic because they are bone experts.
呢個病會唔會影響我嘅壽命？
Beta thalassemia minor generally does not affect life expectancy.
我需唔需要食鐵質補充品？我聽過我需要食鐵質。
Actually, for your situation, iron supplements are not recommended. Thalassemia can cause blood tests to show low iron, but it's not due to iron deficiency, it's because of the issue with hemoglobin. Your PCP might have initially thought you were iron deficient, which raised a concern, but then realized it's actually thalassemia. So, if you change doctors in the future, make sure to tell them and avoid taking too much iron supplements.
明白。
You need to understand that beta thalassemia minor is something you were born with, and it's not a condition that developed recently. You've never had any noticeable symptoms, so there's no need to think of yourself as a patient. You're just like a regular person, with the only difference being that you're a carrier of this gene. You do not need to come back to see me. Just follow up with your PCP. You do not need to check out at the front desk. You can leave now.
多謝。